So we're looking at the studies. I'm going to show you first the studies on term infants and then the studies on preterm infants. And these are the English-speaking studies only from 1990 to present. We have 2 meta-analyses and 4 reviews, and I just listed them down at the bottom because it was too busy with all the references on it. 14 randomized controlled trials since 1990, 4 secondary analysis, and 4 well-designed controlled trials. All of these trials show relatively absence of harm with delay, and I'll show you the one thing that came up. So this was an excellent meta-analysis that was published in JAMA, and she looked at 15 randomized controlled trials and controlled trials with 1,900 babies, delayed cord clamping at least 2 minutes in 1,000 babies, and early cord clamping in around 900 babies. She found at birth, of course, the increase in the hematocrit, which you would expect, and also an increase in asymptomatic polycythemia, mainly from the study in Argentina, but we'll talk about that in a minute. And she found at 2 to 6 months that there was definitely an significant increase in iron status, increase in stored body iron, and less anemia. And no harm from jaundice or from symptomatic polycythemia. So none of the babies that had the asymptomatic polycythemia needed treatment. So also on cord milking, that is an issue that's coming around. I'm not sure of the current protocol on the network study. I just saw Dr. Laptook somewhere, but maybe he had to go. Oh, yeah. I can't hear you, I'm sorry. Okay. Oh, they better hurry up. Neonatal. It didn't get a high enough priority from MFM years ago when we tried 4 or 5 years ago. So anyway, we had this debate on, one of the protocols that they used in a Japanese study was to cut the cord right away, untwist it, have the neonatologist take the baby over and then milk the cord. I hated that protocol. I didn't know why exactly. I mean, I had my ideas because I think it's traumatic to clamp that cord right away, even if you give the baby the blood later. But I think this data from Hooper and Hooper and his group really reinforces the idea that that probably would not be the best protocol to use, and I know they're not using that one. Anyway, on cord milking, there's no systematic review. There's 4 recent randomized controlled trials, 2 on term babies and 2 on preterm babies. There's 8 controlled trials, which I've listed down at the bottom, and you can see they're much older. But I love the study by Colozzi. It was published in Lancet in 1954 with a group of babies with immediate clamping, babies with delayed clamping, and babies with cord milking, and it's an excellent study. If it was reviewed today, it would probably get accepted. Anyway, they found the same benefits as delayed cord clamping and also an absence of harm in all of these studies with cord milking. Most of them are small, but... and then the most recent term study is from Sweden with 400 infants that were randomized to immediate or delayed cord clamping, and by Ola Andersson. And he found less neonatal anemia, no difference between the groups in polycythemia or jaundice. At 4 months, no difference in hemoglobin, but he did find 45% higher ferritin in the delayed group and less iron deficiency. So I want to talk just a minute about the risks. Let me look at time. So there's a lot of fear of overtransfusion, which is why I mentioned it on the slide looking at using the oxytoxics. We have to remember, though, that I think that where all this blood goes is it goes mainly to the lung, because remember I said that 45 to 50% of the cardiac output needs to go to that lung immediately when only 8% has been going there in utero. So it has to change immediately from an organ of fluid excretion to an organ of gas exchange, and that influx of blood is helping it to do that. The placental transfusion creates an increase in circulatory beds in the lungs, and it requires approximately 60 milliliters of blood to accomplish this. So there's no evidence of overtransfusion in any recent either term or preterm studies. And the idea of symptomatic polycythemia is that the baby gets too many red blood cells. The evidence appears to be more that the baby's blood volume expands and the baby gets more iron. And the two meta-analysis and the study found no difference in symptomatic polycythemia. Nobody has looked at what would happen if we delayed cord clamping in moms with diabetes, for instance, but we'll have some data on babies with IUGR in our current study. We don't have that many, but we have quite a few. Again, this idea that delayed cord clamping causes jaundice and hyperbilirubinemia is just all over the world. The theory is that there's more red blood cells to break down. What actually happens is there's better circulatory volume through the liver. Hutton and Hassan found no difference in any of their studies. McDonald and Middleton found no difference in clinical jaundice, but they did have more babies in the delayed group that were treated with the lights. And oh dear, I lost a slide here. Anyway, it's very interesting because when the study that was done in Iowa on pretermers by Strauss, he showed that when the pediatricians knew that the babies had been exposed to delayed cord clamping, the neonatologists knew that more babies went under the lights, even though their levels of bilirubins were exactly the same. So it is important that you blind people, because there are these beliefs that we've had for years, and you can find it in every single reference that you pick up. So it's not unusual that that's the difference.